Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hello, everyone. This is Doug Nelson, the president of the Massage Therapy Foundation, and welcome to another episode of Research Perch. And in this perch, we're going to be revisiting and kind of doing an update on an earlier perch that we did on Project COPE. And with me today, I have Dr. Blair Kennedy and Smith Heavner-Sullivan, and they were on the original podcast, and we're kind of going to do an update. So I'll let them introduce themselves. Dr. Kennedy, can we start with you, please?
Sure. Hi, I'm Blair Kennedy, and I am now a clinical assistant professor at the University of South Carolina School of Medicine in Greenville. I've also been a licensed massage therapist going into my 21st year now. I am also the executive editor and editor-in-chief of the International Journal of Therapeutic Massage and Bodywork, and the governance standing committee chair for the American Massage Therapy Association.
Great, great. And Smith, can you introduce yourself as well?
Absolutely. So I'm Smith Heavner-Sullivan. I'm a registered nurse with 14 years of experience and primarily specialized in emergency and critical care. But I am currently the director of the Prisma Health Comprehensive COVID-19 Registry and a research manager at Prisma Health in Greenville, South Carolina.
Wow, awesome, awesome. Well, thank you both for this project and for taking the time today to kind of revisit it. And as we do that, there may be some people who are looking at this who hadn't seen the first one or don't know much about the project. So could one or both of you just review what Project COPE is really about and how it got started?
It got started because Biddy and I talk too much, and we're kind of like crows with research questions. We see new research questions and it's like, oh, look, something shiny. And that's how it started.
Okay.
He called me up one day and it was just after an AMTA board meeting, and COVID-19 was starting to hit the US, and I'm starting to watch social media and seeing massage therapists getting out of work, and then Smitty calls me on the phone. And what did you say to me?
I was thinking about what it would be like to document the experience of healthcare providers. There's a quality improvement project that we've both been kind of tangentially involved in the hospital we're both attached to, looking at burnout and wellness in the ER. And they were looking at adapting and getting some really specific measures around the COVID pandemic. And we were thinking about what it would be like to have a broader net, to have better information, and to include information from our own perspectives as we're experiencing that. Blair and I started playing with this idea, started tinkering with it, started thinking about who are the populations we need to look at. And we got really interested in this idea of looking at the quote unquote essential versus the quote unquote non-essential healthcare providers. You know, looking at those healthcare providers that are being told, there's nothing you can do right now. You're shut out of the system. You're told your skills aren't wanted, versus those people who are locked in and are in a system that's not equipped to handle what's going on, but don't have the power to change it and don't really have an option for getting out. You know, so we're looking at massage therapists who are especially in the early stages, many were told you have to shut down your practice, you can't see patients, you can't do what you need. When they come to try to help, they're being told, no, you can't come into the hospital and help. And then you have nurses and physicians and all the other, and these are just two of the professions that are in the front lines, staring down the barrel of this pandemic coming through the front door of the hospital, don't have a lot of control of the situation. There's not a lot of good information available. And worse, there's a lot of misinformation out there. And looking at how to do both of those groups start to experience the pandemic, all the things that are out of their control. And then on top of that, looking at all these other professions, but also students, because we frequently forget about students. We knew there were, in previous disasters, in 9/11, in Hurricane Katrina, in a lot of the civil unrests, civil wars that have happened elsewhere in the world, there have been studies looking at people's experience after the fact. They'll do debriefings, and there's lots of really incredible qualitative research just exploring that experience. A lot of the research around burnout really solidified with the research done with first responders after 9/11. There's all this great data, but it's all collected after the fact. And what we got really excited about is having this opportunity to collect the data in real time. And so we came up with this design to give people the opportunity to answer one survey. They have a couple of validated measures that I'm sure we'll get into later, but then also to submit a video blog. And then there are the option to participate in that weekly. And so that gives us two types of data, quantitative and qualitative, letting us examine the experience from two different perspectives with different metrics and be able to bring all that data together to form a really rich and really, really deep understanding of what it's like to live through this.
Wow. It's impressive, impressive. And do we have some idea about how many people have participated so far?
We're getting close to 1,000, I believe, that have taken the first survey. And we have fewer that continually take the follow-up surveys. And I think we've done 16 of those. Was that our last report, something like that, Smitty? And it's okay if you can't fill out every single one. We totally understand that. Yeah. But we're wanting to follow people over time and see how things go along. So that is, but we have, when I was last looking from the data from the beginning of August, we had about 440 of those, almost 1,000 responses are massage therapists.
Is that right?
So thank you. Yes.
Yeah.
So almost half the sample.
That's awesome. I have two thoughts. One, just when we talked, I mean, that was April. In some ways, a very different time. In some ways, a very similar time. I mean, there's no shortage of uncertainty now, just as there was then. It's just as a different form in some ways. And watching my own filling out that survey, it's kind of interesting to watch my own selections, like, oh, that's different. Oh, that changes. And it's hard not to think how that's being perceived and chronicled throughout the process. So it's been an enjoyable thing for me just to participate in as well. And I'm thrilled that we've had that many people. So, which brings up another question. Is it too late to participate now?
It is not. We would love for people to continue to sign up. And if you become a student now, please join. We're still following people. Pandemic's still going on. It hasn't stopped yet.
So, okay, yeah. So that's
so
good.
Please keep coming.
That's really important. So has this ever really, so I know, Smitty, you mentioned about kind of other professions, but with regard to our own profession and in other professions, instead of retrospectively, has this ever really been done before? Or has anything ever gone on long enough that they could actually capture data in this way previously? Do we know?
I don't think we've seen much during. I think, but for me, the most exciting thing has come just in the last couple of weeks as I was preparing an abstract for something. Mm-hmm. And I realized I was just looking at some of the past literature. And you'll see when they talk about how healthcare providers can, in these events and whatever traumatic events that are going on, they recommend massage therapy to healthcare providers to help them cope. Yeah. I saw it over and over again in all of these different pieces of literature. When you'll even see, because I know I had friends there too, saying that they were helping first responders after 9/11. There were massage therapists there. You see it in the reports, you see it everywhere. But you know what? Nobody's ever talked to us and put it in literature. There's
a concept. Yeah.
Wow. And now we have 440 of you and me, and that's very exciting.
Wow.
To be able to see how this is going to really impact us as a profession.
Yeah.
I'm still a massage therapist. I might be a professor in medical school, but I will always and forever be a massage therapist.
And
just to watch it.
Yeah.
It's just been really interesting.
In our last conversation, we talked about moral distress. And I know both of you were explaining it to me, and it's a somewhat of a cognitive thing, but it really became visceral in a way that was surprising to me. That first week that I saw, well, actually the first day I started seeing people again, that feeling of, oh my gosh, I don't know, it's hard to describe it, but it's kind of that you never realize the value of something or the magnitude of it until it's not there anymore. And so that first day I thought of you both when I was back in the office of, now I really understand what that is when you see the opposite of it, or the absence of it. So Thank you for sharing that. Actually, that was a really interesting concept. And actually, maybe, I know Smitty, you touched on this, but for everybody, can you just define that? I guess I'm talking about it, but maybe we should clarify what that is.
And that is an excellent question, because there are a lot of different ways to understand moral distress. There are a couple of related concepts. You can look at cognitive dissonance, you can look at burnout, you can look at wellness. But essentially, it's this feeling of things not aligning. It's the reasons you went into the profession aren't the things you're able to do. It's how I understand it. So as a nurse, I went into the profession because I wanted to be there for people when they're going through something horrible, and be there that I can explain things, help them understand. And so for me, my moral distress is I now work in an office, and I'm crunching all the data and giving evidence to help nurses who are on the front line understand which PPE are the most important, which treatments are going to be the most helpful to their patients, how important is it to prone them, to turn them on their belly. But I'm not there. I'm not touching these patients, and that is very challenging for me to be okay with, because that's the reason I came into this. I'm an ER ICU nurse. I am used to the high stakes, high impact, high activity kind of shifts. But at the end of the day, the thing that made me go back to work was that ability to look a patient in the eye who's going through something horrible and hold their hand.
Yeah.
And I can't do that. I'm not the one there that's taking care of a patient on the vent, getting their mouth really clean so they can actually rest better, right? I am crunching up the numbers to help all the nurses understand what's going on, but I'm not the one doing that.
Yeah.
And so for me, that causes a lot of moral distress, because it's not the reason that I started, even though there are good reasons for me to have moved into the role that I'm in now.
Yeah. It's interesting, talking to some of my friends who were dentists, a few months ago when they weren't able to practice, those conversations was clear, their struggle with that same concept, with all that they felt like they had to give, to be on the sidelines was extremely difficult emotionally for them. So,
which is
and that's also another really important group.
Yes.
Because there's also not a lot of research, but they also have a really high exposure rate. It's one of the most vulnerable healthcare professions for any infectious disease. Their risk, because of the nature of the practice itself, you're aerosolizing everything out of the patient's mouth into your face,
yeah.
Right? But we don't know anything about them, and then they weren't given a whole lot of structure around it.
Yeah.
And they were listed as essential workers, though. When you looked at the CDC and the WHO, they're listed as essential workers, but most of them shut down.
Yeah.
Rightfully so, right?
Yeah.
In many ways, but it is interesting to see that kind of dichotomy and difference there too.
Yeah. Yeah. So obviously, since this is going on, people can still participate, and
Yes.
and that data is still valid. I would just assume the more, especially for our profession, the more numbers we get, the stronger that data will be. And I was kind of struck by this idea of it being both qualitative and quantitative in the way that you did that. I guess I didn't lock onto that in the first time, but now I see the brilliance of doing that both ways. To have both.
It's
of those.
great to hear the stories. So that's what the video blogs, the blogs are for. And it also allows us to see our participants a little bit too. And that's really, I go back to when I watched the first 4 videos that came in, and we had 2 nurses and 2 massage therapists, and I'm watching them. And you could see the difference just in their faces as they explained what was going on for them. And these are like 3 to 5 minute videos, very, very short.
Yeah.
And the massage therapists were kind of like this.
Mm-hmm.
And the nurses were more, they're very tense. The massage therapists, but they were like, it'll be okay. We're going to figure all this out. I'm not working, but you could see almost that big anxiety, and the nurses looked weary.
Yeah.
That's the only way I can describe. They just looked exhausted and weary.
Wow.
So it's that moral distress in many ways, but it's being demonstrated in different avenues. So it's very interesting.
Yeah, I'm curious, and maybe it's not the place, but in processing that qualitative data, how is it that you as a researcher turn that into something understandable and useful? It's fascinating, actually, to look at it from this point of view.
So Ann Blair and I are both mixed methods researchers, but so we really love talking about this stuff. We essentially you create hashtags. Right. So what we have right now is we have 2 students that are watching the videos as they come in, and we ask them to look at the video as if they were posting it on Instagram or Twitter, and think about what are the hashtags that they would put with the narrative that's being told. And that is kind of the 30,000-foot view of what qualitative analysis is. You kind of get what is the essence of what is the person saying and try to group similar stories together. When you do full analysis later on, we'll transcribe those and go word by word and dig, and we'll have a debate about what the meaning was that they talked about this particular situation versus another. Is there a subtext here? We'll watch the video, but really we're creating hashtags. And so for those first 4 videos, the massage therapists were hashtag anxious, hashtag stressed, hashtag budget crisis, right? But the nurses were hashtag over it, exhausted, worn down. So, and then you start to be able to group the different stories together, and then you can look at that qualitative piece along with the survey data and try to get a better understanding. So we have one item that's it's called the mini Z, which is just tries to get a measure of how burnt out someone is, and you can look at it together. So instead of having just one data point, one number that says I'm feeling burnout 4 times a week versus 8 times a week, then I also get the story behind it. So I can look at this is what that person's experiencing that got them to that point.
I have to say, looking at it from this, from the outside viewpoint, it's completely fascinating and amazing that you can turn like a little, 3-minute video that I, have sent in and actually aggregate it with others and find something useful to turn it into something that's helpful for the profession. It's really impressive. And I have to say, in sharing this project with friends of mine in other allied professions, like, I mentioned dentists, but different professions, I have to say there was a little bit of pride because in that way we're leading the field. Do you know what I'm saying? Because they were a little like surprised, like, wow, that is seriously cool. And, it's really wonderful actually that massage therapists are leading the field in that way and helping other fields at the same time. That's a really cool thing that both of you are involved in this. It's really a wonderful thing. So,
thank you.
Yeah. So, anything else that you want to add for everyone? I would say, certainly we want people to participate in it and share it with other allied health professionals, but anything else that we'd like to add?
I'd say if you've already signed up, continue to fill out the weekly surveys. If you're able to, as much as you can. I know it gets a little boring and you think you're maybe like, this doesn't really apply to me. We've actually gotten a couple of emails about that, but it really does.
Yeah.
And it's interesting when we get those emails because they're like, because then we go back and have to look at our surveys like, does this really not apply to them? Do we need to consider changing things?
Yeah.
But continue taking those if you can. We'd really appreciate that. And also we would really love to get your vlogs too. If you can consider uploading those or emailing them if you're not able to get it in during the survey time. But that really does help us look at the data in different ways. What about you, Smitty?
I was going to zero in on professional pride, and Ann Blair and I have a competition to see who can recruit more between nurses and massage therapists.
You are seriously on right now. Okay.
And I'm closing in on her. I've got 300 and something nurses that have participated. We got really close there for a few weeks, and then she's stuck ahead. But you got to watch out. The nurses could overtake and be the majority of sample.
We were just on the Nurse Keith podcast too, so we're getting out there a little bit more to the nurses now too.
Two words here: game on. That's right.
Yes.
So now and can I just also thank you for, when we first talked about this, I hear the word survey and I think, oh boy, it's actually it's so concise. It doesn't take a lot of time. Even the video thing, I thought, well, it's actually it's so easy just to do that and then just boom, upload it and we're done. And the whole thing took so little time. And then to do that every week, it's just not that difficult. And so thank you for making it concise and clear and easy.
A real quick question too.
Yes.
Since you're there and you're doing it, how many videos have you uploaded?
Yeah, I think, so you said that I think there's 16 weeks of surveys. I've probably missed maybe 2 or 3 weeks of surveys. Like, did I do it this week or not? That kind of thing. And probably maybe 4 or 5 videos. So probably one.
So how do you feel after you do the video? After you've talked about it a little bit?
Well, actually, the video is more satisfying than just filling out the survey.
Really?
No. Because you have to. Well, all right. But you have to think about what you're going to say, and things come out that you think, oh, I said that. And in the survey, it's easy to click something because it's not exactly, maybe none of the above is one of the choices, but in the video, you make the choice. And so a couple of those were a little surprising. I had to kind of push my finger to press send a couple of times. So that alone was surprising to just re-watch that and go, yes, that is actually how I feel. So, okay, all right, you guys don't look surprised,
and that can be really cathartic. And that's one of the reasons we chose to design it this way. And so even those of us that are on the research team, we're all journaling. And a couple of us, I think, are actually making our own video blogs as we go through this, so that we can also have that same experience of getting it out. Because, we spend all day, we're working, we go home to our families, and we can't really vent to them because they're already worried about us because we work in healthcare. But having that place to let it out can really make a huge difference in how you're experiencing things.
Yeah, okay. So you don't do it on a conference call and start crying. Yeah. Like someone did this week. Yeah, that would be me.
We were both crying.
Yeah.
We had a conference call where we both work with the diversity and inclusion group in our system, and we both were preparing for a panel for the med students, and got with a very emotional sharing time. Wow. I won't tell Ann Blair's stories, but she.
I did. I got teared up talking about our profession, talking about massage therapists being out of work. Mm-hmm. I did. And then I get a text that says, "Keep it together, girl." Which was awesome. I'm like, okay, well, so that was a very interesting call this past week.
Well, it's been just in my position talking to a lot of people in our profession, as you have as well, and hearing their stories, and this is a way to take those stories and do something positive that will really impact a lot of people with those stories. So instead of just sharing them person to person, let's do something powerful with all of those stories, and our stories are our lives, right? So it's just a really cool project. I hope that you'll both be willing to take the time in the future to revisit this again, because we're still in the middle of this, and I would imagine as we get, who knows, I won't even predict the future, right? At some point in the future, we will revisit this to see where we are then, and how this is still applicable and important. Are you both good with that?
Perfect. And we'll let you know how the competition's going.
Okay. All right. Oh, Smitty, you have no idea. Okay. Because neither one of us have a competitive bone in our body. I mean, no.
I can't imagine why she would.
So listen, thank you both for all the work you're doing, and we will revisit this. And for all of you, thanks for watching another episode of Research Perch, and do take the time to visit Project Cope. We'll put a link to this. It's not too late to join in. It's important. Please join us. Thank you so much. Bye, everyone.
If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.